HOLEP is. So a HOLEP, think of the prostate like an orange, okay? And the urethra runs right through the orange into the bladder, okay? And the bladder is a pump. So the normal function of the urinary tract is that the bladder fills and it empties, it fills and it empties, right? And so what is important for the filling part? Well, the bladder has to be compliant, okay? It has to have decent capacity. And during filling, we don't want there to be contractions, like when people have urgency or urgent incontinence. So, right? And then during the emptying phase, we want the sphincter to open. We want there to be an absence of an obstruction. Well, the problem is that you have the urethra coming out of the bladder, and the prostate is surrounding the urethra like this, okay? And it's like a vice around it. So, what happens when a bladder is trying to empty, but now there's an obstruction? So it creates more work for the bladder. So what happens when you go work out at the gym? You build muscle, right? And so you get hypertrophy, but this skeletal muscle works differently than smooth muscle. Skeletal muscle, it becomes more coordinated, it's stronger, more efficient. Smooth muscle is what?
You don't want it bulky.
You don't want it bulky because it's irritable. It doesn't work well. Okay, so what happens is that you get bladder wall thickening, which is what we assess on a bladder ultrasound. Okay, so you get bladder wall thickening, and you get an irritable bladder. So you have irritative symptoms that you're talking about. You also have obstructive symptoms. Okay, and so the treatment options for BPH is you want to relieve the obstruction. And you can think that the most effective way to relieve the obstruction is to, kind of remove all that prostate tissue, okay? The way a traditional TURP works is when we put a lighted instrument in through the urethra, and we use some kind of instrument, like a loop, to maybe carve out prostate, or you could use a laser to vaporize it, or a little button to use plasma energy to vaporize it. So there's all these techniques to kind of destroy, disrupt, scrape out prostate tissue. The problem is that they're very time dependent, and generally if you have a larger prostate, the urologist isn't going to sit there for 4 hours lasering something or scooping something out. Meanwhile the prostate's bleeding and they're under anesthetic. So generally they'll do an incomplete resection, and then in a couple of years the prostate tissue grows back. Okay. So you're supposed to really get all the way back to the capsule, when you're removing the tissue, okay? So what the HOLEP is it's a different kind of paradigm about how it's used to treat BPH. So what we do instead is we go in with a scope, and we develop a plane between the prostate and the capsule, and we peel it out, just like you have an orange. I mean, you can take bites out of the orange, but you never really get it all out. Or you can get that plane and peel it. So we're basically peeling the orange, pushing the prostate lobes into the bladder, and then we use a separate instrument that goes in there that breaks up and morcellates the prostate tissue and sucks it out, okay? And then the tissue that we get, we'll send to the pathologist for them to look to make sure there's not prostate cancer.